A very good evening, dear listeners, and a warm welcome to our monthly edition of our live Radio Bridge program. This platform gives us an opportunity to discuss and deliberate on the relevant issues and, of course, get insights from the various Northeast states. I'm Dr. Bonnie M. Nicol, your moderator for the discussion this evening, and I wish you all an enlightening, thought-provoking, and, informative as well as interesting time ahead. Well, what could be there on our table for discussion this evening but a very evolving and adaptive chapter in our lives which will make history? Yes, we will be talking about the adaptive strategies for the new normal in the wake of COVID-19. We are privileged to have with us our expert panelists representing the various states of the Northeast. From Tripura, we have Dr. Dilip Das, who is an eminent gynecologist and associate professor, Tripura Medical College, and also the honorable member of Tripura Legislative Assembly. Dr. Deepesh Bhagawati, retired professor, Department of Psychiatry, Guwahati Medical College, Guwahati. And closer home, we have Dr. M. Marbanyang, the State Surveillance Officer, Integrated Disease Surveillance Project, Meghalaya, Shillong. A very good evening to all our panelists and welcome to the discussion. We look forward to an interactive and interesting session ahead. The world is currently emerging from a prolonged period of lockdown. We are now cautiously entering a phase of recovery after a phase of global uncertainty and fear. And as we collectively adjust to this new normal, it is the right time to deliberate on the adaptive strategies for the new normal. But before we look into the strategic measures, let us get an overview of the current scenario of the pandemic from our panelists representing the different states of the Northeast. All right, should we first of all hear from Dr. Marbanyang from Shillong? Hello, Doctor. Good evening. Can you quickly give us an overview of the overall scenario, as in, how people have been taking this pandemic?
Okay, yes, a very warm good evening. In our state, initially there was this active community participation, but as time goes by, the community is a bit complacent. In the sense that, because I think it has been going on for many months, so most probably that fatigue has set in. Anyway, our contact tracing teams, at the district level, they are doing the level best, to contain the virus by this high-risk contacts, by identifying all the high-risk contacts, and then testing them, okay? And also, the main thing is that as of date, we have many cases who are under home isolation, the positive cases. Initially, there was complacency from the community to allow the active cases, positive cases to be under home isolation done. But now, the number of cases under home isolation has increased.
All right, Dr. Marvanyang, we'll come back to the community participation because that is something very important that we need to really dwell on. But we have our resource person from Tripura, Dr. Dilip Das. Good evening.
Good evening, madam.
Can you quickly give us an overview on the pandemic situation in Tripura?
Tripura, actually, when all the country was suffering, that time we also suffered. But now it is in the waning stage. Death rate is fallen, 1 or 3 in a week, and cure rate is almost 96%. So we are in a better stage now.
All right. So how have the people, in Tripura been accommodating during this pandemic? Was there so much of fear and anxiety?
We don't see that the people are very much in anxiety or fearing. But the people who are actually can understand the situation, definitely they are very cautious. And our government is trying its best to awaken the people, make them aware, and all the health department, everybody is working in that direction. So sometimes we have to impose a behavioral change, but now most of the people have accepted the problem of the disease it's casualty and everything. But still in the marketplace or some other places, people are gathering. But at least we are trying to make them compel or make them aware to put on mask and to maintain a distance as far as practicable.
Yes, Dr. Das, you have an important role. Being the Honorable Member of Tripura Legislative Assembly, I think you can really do something for, the welfare of the people there. Taking stringent measures, because you said, in the marketplace, they've become complacent and they don't use masks and, obey the protocol. So I think we need to be more stringent on that.
Yes.
Okay.
Many offices or many places and shops in marketplaces, they are keeping the sanitizers. Even in offices, there are staff already standing in the gate of the office and they provide sanitizers.
There was a short journey there from the coronavirus lockdown towards the new normal. We are all facing the challenges of maintaining momentum and motivation, doing something productive while trying to stay safe at home. How exactly are we to adapt to and survive a situation in which change is the new normal? Yes, change is inevitable and gradually everyone will get used to it, but we need to think ahead of time to be able to adapt to new changes. Before going to these strategic measures again, let us look into the challenges that are foreseen or unforeseen before us. All right, so Dr. Marvin Yang, back to you.
Yes, a main challenge is really the complacency of the community in all the maintaining and following the protocols, the health advisories. But, our government had taken stringent measures because just recently we have identified NGOs whereby these NGOs will go to the different districts of the state and create awareness, give awareness to the people on all these health advisories like wearing of masks, maintaining social distance, and washing their hands frequently with soap and water, and also to remove the stigma and fear from the community as a whole. So we have the first phase is over, and now again the second phase is ongoing. So that's a challenge. At least now that's the challenge. We want to overcome the challenge. So we have identified this NGOs for that. And also another challenge is that as days pass by, these people are reluctant to get themselves tested and they are not following some of them, I'm not saying overall, but in some pockets of the state, some of them, even though they are high-risk contacts, they refuse to get themselves tested, okay? So even after giving them awareness also, because we are guided by some misbeliefs, there are some pockets in the state. Otherwise, as a whole, they are abiding. The others are abiding by the rules and regulations, whatever is supposed to be done. No? So these are our main challenges in some pockets because of misguided beliefs.
Yes, let's hope that all the listeners listening to this program, to this discussion, it will be a kind of an awareness program and they'll spread that to the others as well. All right, we have our resource person from Guwahati, Dr. Deepesh Bhagawati.
Hello.
Yes, I'm asking everyone to give us just a quick overview on the pandemic situation. So I think we would also want to hear from Guwahati. Can you just tell us a little about the pandemic situation in Guwahati?
Thank you very much for the program. And the current situation in Guwahati and what we have been seeing since the month of March was that initially when the lockdown started, there was a panicky situation. And then people were very much scared and they were at a loss. And, the lifestyle was suddenly, there was a change in the lifestyle. And people who were going out had to be in all the time at home. And subsequently what happened, there was a gradual opening up what was there. Then people started moving out. But what we saw was that, from the side of the mental health problems that we see, was that, people, we had some patients with a lot of anxiety. Then many people had gone into depression, including some had, self-destructive thoughts. And so that is a problem that we have been getting on. And there is a sudden increase in the problems related to alcohol withdrawal, the substance withdrawal. People who are substance abuse were not getting their substances, and their withdrawal symptoms were increasing. So that is the situation. And then gradually what happened was that what I have seen, most of the people have started adjusting the lifestyle in-house lifestyle. Though they had adjusted, but then there is always a feeling of apprehension, general people. And some questions that I have been asked by some of the patients, some of the individuals who have suffered from general physical illness, is that suppose I have a crisis now, whether I'm going to look after in the hospital. Because many hospitals were refusing to see patients without a COVID negative report. And by that time, the crisis deepened. And so that was a major issue with muscle problems. But by now, things have more or less settled down. And when I talked to the doctors, some of the doctors who have been working in a COVID hospital, they told me about the kind of fatigue, being at a loss at times, and the number of days have been increasing. So they were also very much stressed out, and doctors were also stressed out. So we see two sides. And about the policemen also who were on duty, some of them were quite frustrated. They were asked to do their duties. They were asked to stop people from going out with that mask. But when they're trying to impose it on the individuals, people are not obeying. So there was a frustration. So what we see is that overall, all people in all stages of society had an impact. And for most people, for many people, they couldn't see when it is going to end. Even now, that is, we see that, things are better now. We are getting less cases, but it's a problem.
Yes. And I think, like rightly mentioned by you, as being the right person to talk about mental health. You're from the Department of Psychiatry. Well, psychologists and counselors have a pivotal role to play in helping people cope with the challenges, especially during this unfolding crisis of pandemic COVID-19. Since I'm still in conversation with you, I would like you to tell us a little more about how mental health programs have been initiated to help people cope with this.
Things that they have taken up is that, online counseling. Online counseling, people who are in need. There's an organization called Monon that had been started by the National Health Service under NHS. This program was very effective in talking to people who are in distress, and they could go online and talk to them. At the individual level, we have been talking to people, who are in distress. Whether, for me, say, people who are undergoing treatment for psychiatric ailments, and during these people, many of them had exacerbation of symptoms. People who have anxiety had problems, people who have depression, there's exacerbation of symptoms. So they want to talk to me, but they couldn't come to the hospital, so I had to talk to them over telephone. That is what I've been doing. And that was quite helpful. So these are two programs. One is that at the government level, the National Health Service, that Monon program was quite useful, and otherwise at the individual level, we have been imparting. The next thing was that a lot of public issue-related webinars. I am a psychiatrist based in Guwahati. So Assam Psychiatric Society, we had kind of discussion with people online, programs we have done, and that was very effective on mental health issues. So some of these programs are very useful. But then this could solve the problems only partially. But I am sure that there are many people who are suffering, but not being able to, contact the mental health professionals. I want to need it. And general physicians are also offering this kind of counseling. So these are the kind of programs that we have been having now.
I think that would be one of the best strategic measures if we are talking about strategic measures, because the physical health, yes, but the mental health also we cannot ignore. That is also important. As you already mentioned, many had undergone stress and anxiety and frustration. So for all that, we need to cater to the people. Okay, so it is actually difficult to fathom how in these modern times a virus could take such a deadly turn, spreading to other parts of the world, causing a wide ramifications, even in developed European countries. Well, and in those initial days, the buzzword was stay home, stay safe, and break the chain. And people, derived energy being one with all clapping hands to honor the selfless soldiers, risking their lives and lighting of lamps. Yes. All that said and done, feeling overwhelmed by constant adjustments and sometimes confused has become a part of the new normal. The new normal is change, right? Fast-paced, constant, and at times unpredictable. All right, here we've got connected with Dilip Das again here.
Yes.
Yes. We were talking about how, the transition from the onset of the pandemic and to the new normal. So how has life really changed due to COVID-19? And, we say the dubbed word, the new normal, has brought along some new rules and a different routine. So what exactly is the new normal that we are talking about?
Actually, first of all, it is very difficult for me to think that it is a new normal. Rather, it is an abnormal situation. Out of compulsion for the safety and security, we are calling it a new normal because we will have to adapt on it.
We are bound to.
Yes, and that is why it is a new term that is a new normal. But I don't find any rationality to call it a new normal. Actually, what we are doing is a safety key. Whatever you're doing, say, previously used to, whenever we meet somebody, we used to handshake. So now we don't shake hands, rather we go for pranam. Adda, that is a very common factor for us. We have stopped it, but rather it has gone onto Facebook and other WhatsApp or Twitter and everything. You just think of the doctors. For how many days there was a relation between doctor and the patient. And we used to call that touch of a doctor is almost like touch of a mother. So we are also afraid we are not touching the patient. In many occasions, there is a chance of a misdiagnosis. So everything is being changed. Actually, we will have to come back to our original state, but till then, now at this point, it has become almost certain that there is a when the vaccine will come, yet we don't know whether it will come in this year or the next year, what will be its efficacy, how long its action will stand. So there are many questions. So we will have to certain that we put on mask every time, whenever possible, because it has been proved the infection is a droplet infection. And we also know the small droplets can go more than 6 feet. But we cannot do our social activities by maintaining a distance of 6 feet, because many of these streets are not even 6 feet. So how we can do? So we have to save ourselves. So we have to put on mask, not to go to that is where there are gatherings. We have to wash our hands frequently. And there are many other factors, like taking exercise, very good sleep, taking a nutritious diet, meditation. AIDS was a panic once, but till now we know how to behave in a case of AIDS, and nobody now talk of the AIDS, because we know that we will have to live with AIDS. So the day may come, because there are many strains of coronavirus. But COVID-19 is such a virus, it affects lung, and almost 6% of the people are affected by it. Though the death rate is 1 to 3%, but he who suffers, he knows. And there is also post-COVID, there are some complications for mental makeup, encouragement.
Okay, so different people have different takes on this and different views, right? So according to you, you say it's not the new normal actually, but we can revert back to the old. So we look forward to, better life, of course, but at present, why we call the new normal is because of all the new adjustments. Like, for example, work from home. It's one of the strategies that has been adopted because the challenge before the higher level policymakers and professionals and institutions and managements, is to ensure that work goes on. Work remains unaffected despite such turbulence. So work from home, we call it in short WFH, is one of the strategies. So that is also a new normal, because previously, we wouldn't have worked from home. Okay, so we're looking at the strategies, and I think we'll hear from Dr. Marbanyang, being from the health background. Dr. Marbanyang?
As of today, we need to adapt to this, whatever we call it new normal. We have to live with COVID. We don't know for certain when, this COVID will disappear. And so while we are waiting for the vaccine, as responsible citizens, we need to act in solidarity to prevent further transmission of the virus.
Yes.
Because as of today, I think the only cure is prevention. And as we are opening up, we have to open up the economy. And we cannot have these lockdowns every now and then. And because this is affecting especially the daily wage laborers. So our main strategy is, while we are going, yes, for testing and high-risk contacts and all those, isolation of positive cases, we need to really protect the elderly people and also the persons with comorbid conditions. Because these are the vulnerable population who, succumb to this COVID-19. Because as of today, we are seeing in our state, most of the deaths are these persons, elderly persons, and especially the persons with comorbid conditions, around 6-7% of the deaths. So our main aim is, to protect these vulnerable population. And our government has also developed strategies whereby we have developed diaries for the elderly, and we have incorporated instructions which these elderly are to follow and what they are to avoid, along with a checklist which they are to follow. And also another strategy is that we have to also ask all the districts to set up these SPO2 centers, especially at the containment areas, whereby, they can keep these centers either at the pharmacies or they can identify a place so that these elderly people, they can be monitored, their oxygen saturation through the pulse oximeters, and also their blood pressure can be checked. And also these elderly people and comorbid people, they are being followed up by the healthcare workers, especially at the containment areas. So these are the strategies we need to develop, especially to these vulnerable populations. And also, yes, as we know that our main objective is, as Dr. Dilip had mentioned, regarding the following all the health advisories of wearing masks, physical distancing, and washing of hands with or use sanitizer. And so our main strategy is that we need to get the support of the community. The community leaders or the headmen, they are the persons who will be responsible to educate, to create awareness to the general public, especially in rural areas. Because I think in rural areas especially, they listen to it. They are like their gods. They listen to whatever they say. So if the headmen and the community leaders, they take ownership. So this strategy will really help so that people will really follow all the protocols, all the health advisories. In that way, we can also contain the virus to an extent.
Very true, very true. I totally agree with you, because that was what I really wanted to mention, It's not about just the government initiatives. It's where the community can play a very important role, the community leaders. Because in the very beginning, when all this started, I think they had really taken up the headache of, keeping on announcing every now and then, about the social distancing, wearing of masks and all that. But I think with time, it's getting a little complacent. So I think the health department needs to create a kind of an awareness, How about, distributing pamphlets, do more on awareness so that the people will really take it seriously?
Yes. Actually, in our state, we have a state response team whereby we have different units. Some looking after logistics, some looking after IEC, surveillance part, and so on and so forth. The IEC unit is also doing its part in developing diaries for the behavior change diaries also for that matter. Okay. So, and also we have a behavior change management app also, whereby they can always log into this app, and there is a checklist which they have to follow. So, and also the extensive IEC materials like pamphlets and the posters and also hoardings are being set up, and awareness is given to the community people. And as I had mentioned, we have to engage the NGOs for giving awareness to the community, because this is our main target. If the people, if they follow all these health advisories of all those SMLs, that means sanitizers, masks, and social distancing, that is the one.
Is there any kind of monitoring going on?
Yes, monitoring is going on also, because as of now, we have the COVID management committee in the different communities, localities. So these are the ones who monitor that these people, the trainings are given in the quality manner, okay? So I think with regards to IEC, we are doing extensive IEC campaign, and also we having a sort of a competition whereby school children will be engaged in poster campaign, okay, on COVID-19. That way, also the children can take the ownership, spreading awareness to their families and also to the neighbors and the community as such.
All right, Dr. Marvin, I'll come back to you. Dr. Dilip, yes, we are talking about, how to navigate the new normal of the pandemic. So how would we cultivate the habitual changes that endure?
It is because of a situation that if you want to enjoy your known world, then you will have to sustain and you will have to live. And if you want to live, you don't know where are the viruses. It may be anywhere. It is like a pocket thief. So you should be every time cautious that somewhere in the air or in a hard surface anywhere there is a virus. Considering all this, the only one precaution, particularly that is the wearing mask almost in every possible situation to save ourselves and also to save other people. Even if you have recovered from the disease, it is not guaranteed that you cannot infect or you cannot be infected. So again comes to maintaining the precautions, the social distancing, hand washing. At least we are not so prepared at the beginning, but with the speed, everything our government has acquired the PPE, starting of the COVID dedicated hospital, the dedicated center in a footwear basis, and there was not a time when there was lack of any medicine in the government hospital or the government centers. We have given the medicines, those who are in home quarantine, we have given pulse oximeter, thermometer, and those who are poor, they have been provided with rationing and also financial help. And there are medical teams everywhere in the rural level. They are taking care of the people who are in the home quarantine, whatever they needed. So we have tackled it very nicely, and it is not a complacent that everything is done. Government is again in the same way we did in the peak of this disease. So we are not reluctant, but every time we are trying to make understand the people. And now through the discussion, electronic media, everywhere in the articles, educated people they know what to do and what not to do. But the very poor people, the day laborers, who are bound to rickshaw pullers, they are bound to go to the outside for their bread and butter. So we are trying to also make them aware regarding the problems.
All right, Dr. Marbanya?
Yes,
Yeah.
yes.
So you're talking about the complacency of people around, when it comes to the SOPs and maintaining social distancing. So what would you suggest? What would you suggest as a, medical officer? So what would you have to say to them?
Yes, actually, the government has given the protocols to which are to be maintained by all the citizens. And I think with the active participation of the district administration, also monitoring by the district administration and the COVID management teams at the respective localities who will monitor them, seeing that this physical distancing is maintained, especially as of now because the economy will be open, so shops also and marketplaces opening up in Meghalaya. So this is very crucial, maintaining. I understand at the market areas it is quite difficult to maintain this, this physical distancing in areas with very narrow lanes and all. But I think if the people, they really understand that way, they should abide by whatever the protocols. And recently also, there was the Hawkers Association who had given trainings to all the people in the market areas, okay? They are part of that NGO training which I had mentioned. So they are the Hawkers Association. So they had given training to the people in the market areas. So I'm certain and I'm sure that they had given a quality training so that these people also, they will follow whatever training they had received, abiding by all the health protocols. And I think it is the ownership of every citizen, because all of us, we should assume ourselves as symptomatic carriers. Until and unless we assume ourselves as asymptomatic carriers, then only we will understand that we will not infect others also. That way we will abide by all the health advisories. So I think it is the ownership of every citizen, and also the health department, the administration, and also especially the community leaders and the village darbars. I think as such, everyone should take ownership on so that we can contain this virus. Otherwise, there will be a surge in cases, especially winter, where, people will be indoors and,
we need to be extra careful.
The virus can
Yes. So it's all about, moving on from containment to mitigation. We need to be extra alert. And yes, in today's new normal, the key to successful strategic planning is to do a little changing ourselves, to approach strategic planning not as an event or a means to an end, but rather as a dynamic, ongoing learning process or cycle, and we are all in that. All right, let's hear from Guwahati. Dr. Deepesh?
Yes. As you say, this is a new normal. I think this is a very apt term. It is the people who will take, this is a transitional time. For any kind of transition to take place, it is a process. It's a gradual process. So it will take some time because people have gone through a crisis. and they are hopefully coming out of the crisis. I'm saying hopefully because we are not very sure and people are apprehensive still now. So, there's a gradual process. People are sending their children to school now. And I think that if people maintain all the protocols that have been mentioned by Dr. Marvanyang and Dr. Dilip Das, I think things will generally improve. But then the question of anxiety will persist. So what I would suggest for everyone to reduce the anxiety, which is quite often, it is without any reason, it is unreasonable anxiety, and that people can take certain measures to reduce the level of anxiety. I think that is of primary importance. You follow the protocols, that is absolutely important, but at the same time, the anxiety, which is at times unreasonable, at times reasonable, to reduce that also, you can take some actions at a ground level. Forget about going to counselors. It is not possible to go to counselors each and every time, or not even possible to talk to them. So what is important is that in the families or among the friends to keep in touch over telephone. Now, if I have a problem, then I would feel good if I can talk to someone who is unbiased and who doesn't give an opinion about my problems and listening. So active listening to a problem of a certain individual gives a lot of relief to the individual. So we have to develop the habit of listening to the problems of others. Solutions, everybody can come out their own solutions given the time. So that is one component of, this is a simple way of maybe you can call it counseling. But what I'm saying is that active listening is very important.
Yes,
if someone is
very
feeling
important
sad,
component.
Okay, how sad do you feel?
Yes.
If people say, no, sometimes I feel like harming myself. All right, it must be a very bad feeling, so can you tell me about it? So if I talked about it, or if I, or that somebody listens to it, and an unbiased way, it is very helpful.
This is, I think, the key point that we need to take from this deliberation this evening. Creating awareness among the masses on using of the SOPs and all the rest that we need to do.
Absolutely important.
And it is pertinent to note that many schools and other institutions have been even used as a quarantine center. Therefore, it is of utmost importance to properly sanitize all these schools as well before reopening them. That is another strategic measure that should be noted.
Absolutely, yes.
All right. So, Dr. Marvanyang, one final word from you regarding the strategic measures. Would you like to conclude?
Yes, as per the protocol developed by us, we always advise the use of the Arogya Setu app so that we will be able to map out where the positive cases are. As such, also in our state, we also have the COVID helpline, which will this is just a new initiative so that people maybe they have any queries on any aspect, maybe testing or maybe quarantine or whoever wants to come to the state, and this also will help them. So we have trained these agents, who will be helping us out in answering to the queries of this COVID helpline. So the main thing is I would like to request especially the different stakeholders and especially the community leaders to active participation, because it is through them that mainly we will be able to contain this virus through their creating awareness to the masses.
All right. Thank you, Dr. Marvanyang. And once again from Dr. Dilip, one last line of regarding the strategic measures. Dr. Dilip?
Actually, ultimately, we will have to accept that it is a new threat to the human society. So first of all, we have to accept as a real threat. And the reality is, till now, there is no vaccine. Till now, there is no specific medicine against this virus. So how we are surviving? Ultimately, we have learned that if we cover our face, it's because it is spread through respiration, through spitting or coughing or sneezing.
Okay.
So only a mask can save ourselves and also can protect the others.
All right. And then we need the sensitization of students, parents, teachers, and absolutely everyone out there, the community leaders, as we mentioned. Sensitization is very, very important. And so, listeners, with that, we have come to the end of our discussion on adaptive strategies for the new normal in the wake of COVID-19 in our live Radio Bridge program. We have discussed on the different strategies to overcome the challenges, and what deeply penetrates in our minds is that new thinking and innovative actions are required to adapt to the new normal life. We cannot rewrite the chapters of history already past, but we can learn from them, evolve and adapt. The new normal is certainly a different normal, and we need to join hands together for a better normal. I thank our panelists for having shared their expertise and their outlook on the pandemic and the adaptive strategies to adjust to the new normal. Thank you for your valuable time. Once again, the panelists, Dr. Dr. Dilip Das, an eminent gynecologist and associate professor, Tripura Medical College and honorable member of Tripura Legislative Assembly. Dr. Deepesh Bhagawati, retired professor, Department of Psychiatry, Guwahati Medical College, Guwahati. Dr. M. Marbanyang, State Surveillance Officer, Integrated Disease Surveillance Project, Meghalaya, Shillong. I also especially thank all our dear listeners for sparing your time and being a part of our program. Stay focused and productive. Stay healthy and safe. Follow all the protocols. Let us join hands together for a better normal. And yes, I would also like to thank our engineers on duty, A. Karkungor and S. Chowdhury. This program has been produced by Evelyn Kongsit, Program Executive, and assisted in production by Mumsi Blah. This is your host and moderator, Bonnie Nichols, signing off from the studios of the Northeastern Service of All India Radio. Bye-bye. Take care.